In a sexual crime investigation, the speed of evidence collection is crucial. It also needs to be collected and processed carefully. Strong objective evidence helps to build the case in bringing the suspect to justice. Some evidence have to be collected from the victims. This process, if not done sensitively, may add to the trauma. Similar to the initial process of reporting and interviewing, the next process of evidence collection is also done in a victim-centric manner. Other than processing the crime scene, victims may be required to undergo a forensic medical examination at a hospital, or at the One-Stop Abuse Forensic Examination Centre, or One Safe Centre for short, within the police cantonment complex.
At One Safe Centre, a trained doctor and nurse caring for sexual assault victims from either KKH, NUH or SGH will conduct the medical examination. Due to the intimate nature of the examination, some victims might find the questions and examinations intrusive. We assure the victims that the examinations are conducted with sensitivity and professionalism, ensuring minimal discomfort. There will always be a female chaperone present throughout the entire examination. The questions involve collecting medical history and the details of the assault. This is followed by a thorough examination using the sexual assault kit to document injuries, collect swabs, screen for sexually transmitted infections, and sometimes pregnancy. Victims are offered medical and emotional support even after the examination. This includes emergency contraception, infection prophylaxis, and follow-up care with specialists or medical social workers if necessary.
For children and young victims, due to their young age, we will refer them to a hospital with children's emergency, such as KKH or NUH, for forensic medical examination to be conducted.
Young children and adults in certain cases may require anesthesia to help in the assessment and treatment of injuries. Different examination techniques are used depending on the nature of the assault and victim's age and the assessment by the attending clinician. The extent of the forensic medical examination and the types of forensic specimens collected, such as DNA swabs, blood sample for sexually transmitted disease, and toxicology are determined by the nature of the assault. There will be follow-up medical appointments with the victims to review the STD test results and any repeat test. An appointment with medical social worker is also arranged to offer the necessary support throughout the process.
For select child and young victims of intrafamilial sexual abuse, we may proceed with a multidisciplinary interview, or MDI.
The MDI model is a joint initiative between Child Protective Service from MSF, SPF and KK Women's and Children's Hospital to reduce the need for child and young victims to recount incidents of sexual abuse to multiple parties and reduce the risk of re-traumatization.
Our immediate aim is to obtain critical information that are necessary for the investigations in a sensitive manner, avoiding multiple interviews, performing forensic medical examinations, and supporting the immediate and longer-term healthcare needs of the victims.
KKH serves as a safe place for the victims until the required examinations and safety plans by MSF and SPF are completed. When the victim arrives at KKH with a school counsellor or caregiver, a child protection officer and IO will conduct the joint interview in a private room using anatomical dolls. A medical professional from KKH watches the interview from a live feed in another room that cuts down the number of times the victim has to recount the experience.
When there are serious child protection concerns, MSF's Child Protective Service will conduct a social investigation into the child protection concerns to assess the safety and the well-being of the child. These are typically cases where the alleged perpetrator is a family member. CPS will work with the parents, caregivers, extended family members and community partners to ensure the child's safety and well-being. CPS may also refer the child and family for services where needed, example psychological assessment or intervention to address trauma or underlying issues.
Care teams from KKH will also provide additional psychosocial support and work with the police and MSF in ensuring that safety plans are in place.
CPS focuses on ensuring a child's safety by developing a safety plan with the family to address the safety and risk concerns for the child. CPS will also involve the extended family members and professionals where required in the safety plan to keep the child safe. If a child cannot remain safe at home, the child may be placed in out-of-home care with relatives, foster parents, or at a children's home. If the child is placed in out-of-home care, CPS will review the family's progress with the family and professionals supporting them. The child would only be reunified gradually after the safety and risk concerns have been addressed and the family has shown positive progress towards reunification. This ensures that the child's safety and well-being are prioritized throughout the process.
Once evidence is collected, it is then sent to the Health Sciences Authority for analysis.
The DNA profiling lab will obtain the intimate swabs from the sexual assault kit, while the analytical toxicology lab will handle the blood and urine samples. We examine these swabs for the presence of semen and process them for DNA. Timely collection of these swabs is crucial to minimize degradation of semen and DNA. We then interpret and compare the generated DNA profiles against both victim and the suspect for identification. Finding semen and the perpetrator's DNA on these intimate swabs can provide strong, incriminating evidence against the perpetrator.
In the analytical toxicology laboratory, we receive and process blood and urine sample where they undergo chemical extraction. We analyze this sample using analytical equipment to detect and measure trace amount of substances like dead-weight drugs, central nervous system depressant, medication known for their calming or relaxing effect, and illicit drugs. We then provide the analysis report to the police. They use this report as evidence in the prosecutor case.
Police officers and prosecutors share the same goal: pursuing justice for the victims. We want to secure a conviction, and so our job involves scrutinizing the evidence to strengthen our case in court. Some cases are strong evidentially, for example, where the suspect could have filmed himself in the act of abusing the children. But not all cases have strong incriminating evidence, especially cases where the sexual abuse took place at home. In these cases, the most crucial element is whether the victim is able to handle testifying in court. Testifying in court can be a very daunting experience. We try to prepare victims for trial by arranging for court visits, and in some selected cases, victims are also given the option of testifying via video link. I always take the view that victims of sexual crime have had their free will and personal choice in a very intimate area taken away. I see the investigative and prosecutorial process as a way of trying to return some of that personal agency to them.
Even after the investigation is done and justice has been served, some victims still feel like they cannot cope. We work with various stakeholders like MSF, schools, and child protection specialist centers to provide care and support for the victims.
CPS may refer child victims and their families to our MSF psychologists or community partners for services, assessments, and therapy where needed.
MOE school counsellors are the trusted significant adults in school where students feel safe in disclosing and allowing the school counsellors to journey with them during the difficult times. Through the process, it is important that we put students first, and sometimes we will refer them to community partners for specialized intervention and support them as they continue schooling.